I know that Canada is a big funder for UNAIDS, but in terms of the amount of money that we provide to support initiatives internationally and locally, it is not enough for the need currently. Folks have been disproportionately affected by COVID. So when we think about care, we have to think about all the basic needs, all the social determinants of health. Yes, we have free healthcare if you are a landed immigrant and you have immigration status in this country. But if you don't have papers, you're not going to have the same opportunities to access care and treatment.
To do the outreach is also problematic at times for the LGBT organizations, depending on what relationship you have with your national AIDS program, and this is something that, whether through Global Fund or any other funder, our countries are committing to working with key populations. But key population is not at the center of the response, not the way that they should be. So it's one that it is still amazing that the LGBT community still gets blamed for, especially the men, for HIV even in 2023. And yet we're still struggling so many years later, having this pandemic almost outlive us 20 plus years. And we still feels like we are still in year one trying to understand the pandemic in itself.
Our community has actually improved because we used to have very minimal package for the LGBTI persons. But now as communities are growing, we're also finding that from level 2, level 3 clinics are coming up, being implemented, designed by the community. And by this means that they can be able to render what they really want to see in these facilities, apart from what is being offered general facilities. Because we all know the general facilities are always packed, they are always full. Some of them are really dirty, and some have no all those comprehensive package that the LGBTI community would wish to see. The prevention commodities, the treatment commodities are rare. I can tell you for sure. One, because the procurement processes, we know like in Kenya, the health department has been devolved. So things come from the national government trickling down to the counties, and it takes ages to reach that one person to get the ART. What does that mean when a community site does not have commodities for its beneficiaries? It's like massacre. Like, how do you expect the key population or the LGBTI persons to survive without drugs, to survive without the prevention commodities? It takes years. And when it comes, probably because they have stayed in the store, when you start looking at the expiring date, it only gives you 4 months or 8 months, knowing that fully well that after 6 months, there will be scarcity of the same commodity that you've been waiting for years. So for us, the availability and the accessibility of them is new, because you can have them at the moment, then all of a sudden you cannot be able to access, because the government will give priorities to the government facilities first before you get your commodities as community facilities. So you also see it becomes very hard to even run clinics when the availability and commodities are not available. Something else, when you ask me about commitment, I just think about decriminalization, especially what is happening within the East African region, that because of criminalized population, the key population as criminalized population, they are not even able to get services. But if we could decriminalize and push the government to do this, and the CSOs within the fraternities of Kenya put that as an agenda to not only look at people because of their sexual orientation, their gender, their religion, but look at people as human beings, then that will be a very good commitment to the government and from the civil societies. Looking like in Kenyan perspective is the first time you go as an LGBTI person and you're probably feminine and you go to a clinic, and the first thing people do, or the healthcare workers do, is look at you twice. Not even asking what is your problem. They look at you twice and they call each other. We need to change that. You see, first of all, you have to treat people as human. I talked about decriminalization and making sure that we know everyone is human. Looking at the laws in Kenya, they don't favor the LGBTI community. Right now, we are having bills coming in parliament up and down every day, just to make sure that they are actually fencing the need of that LGBTI person to get better services. How do we get better? How do we even end HIV, whereas our attitudes are bad, whereas we have unsensitized healthcare workers? We have to unlearn and start from a point of treating everyone as a human being.